when you have vascular disease, vascular pathology, especially aortic pathology, which is my heart and soul, these are the patients who are going to need your expertise for the rest of their life. The beauty of vascular surgery is that you're really taking care of patients head to toe. We take care of patients with aortic disease, with venous disease, with renal mesenteric disease, if they have any issues that are related to their hemodialysis access, limb salvage, peripheral arterial disease. So the entire spectrum of vascular care that the patient may need, we do provide that. So my specific expertise is aortic care. So that's something that I really enjoy, and I'm very passionate about the aortic care. It really helps me take care of patients who sometimes are boxed out of any treatment options. So for instance, one of the procedures that I really take pride in is the care of the patients with complex aortic diseases, whether it's dissection or post-dissection thoracoabdominal aortic aneurysms, post-dissection arch diseases, or just aneurysmal arch and aneurysmal thoracoabdominal aortic diseases. So in these patients, they will need something more than what's available commercially for use from a stent graft perspective. And a lot of these patients have multiple medical comorbidities, so they may not be able to tolerate the open procedures that are the gold standard. So what do you do then for these patients? Do you resort to saying that, hey, sorry, nothing for us to offer? So I think this is where the expertise that I bring from an endovascular perspective is very, very beneficial to these patients. So I have an investigational device exemption that is approved by the FDA that allows me to create the devices that are tailored specifically to their individual anatomy. And that allows us to repair their aneurysms with a device that's really customized to them, and offer them a repair. These procedures are done percutaneously, so most of these patients will be home in 24 hours. And that's remarkable. These are patients who were boxed out to be told that they're too sick for any procedure, and then they're going home the next day after getting their entire aorta repaired. I think that is miraculous, that is remarkable. And that brings a lot of joy to me, and I think this is the essence of what I do, and I really enjoy doing that and providing that for our patients.